Hi, I'm Dr. Barry Gillespie. I practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, the United States of America. And today I'm going to discuss craniosacral fascial therapy and dentistry. I remember when I was 5 years old, I was visiting my grandparents, and my grandfather was a dentist. And he went to Penn in 1906. He graduated in 1906. And this is his license right here. And just to give you a frame of context, Novocaine was first became clinically accepted in 1905. So he was practicing in 1906. And my dad was a dentist. He graduated in 1934, and he became an orthodontist in 1939. And I kind of grew up with dentistry, and when I was in college, I decided, gee, I think I'd like to go be a dentist too. And I went to dental school for 4 years, and I loved surgery in dental school, so I decided to go an extra 2 years to become a periodontist, a periodontal surgeon. And this is my degree right here. So it's a family of about 110 years of service in the dental field. About 20 years ago, I discovered the craniosacral fascial system. And this system has two components. First, the craniosacral, and second, the fascial aspect. The craniosacral is the brain slowly expanding and slowly contracting. And each expansion and contraction is a brain cycle. And we call this the brain breathing, like the lungs are breathing and the brain will breathe. The brain will slowly expand and slowly contract. And I have this little toy to show this. And when mothers bring their children in, their child's heads may be very tight at the first visit, where there's no expansion and there's no contraction. But after the first visit, the brain may slowly start to expand and slowly start to contract. In the second, third, and fourth visits, the brain will start to really open up. And hopefully, we'd like to have the brain expanding around 100 seconds and have the brain contracting about 100 seconds. So this expansion and contraction would be about 200 seconds. The brain cycle would be about 200 seconds. So this is the brain breathing, where it's like the lungs, where they expand and contract, and the brain would slowly expand and contract. The sacral aspect is the tailbone aspect, where the sacrum is right at the end of the spine, and the sacrum gently flexes and extends as the brain expands and contracts. So as the brain expands, the sacrum, the tailbone, will flex. As the brain contracts, the sacrum and the tailbone will extend. The fascial aspect is interesting because the fascia, the connective tissue of the body, surrounds every muscle cell in the body. It goes into every organ. It goes into the bones. It goes into the eye, into the teeth. It goes all over the body from head to toe, finger to finger. And it surrounds blood vessels, and it surrounds nerves. And when it puts pressure on nerves, it can put pressure of approximately 2,000 pounds per square inch on nerves, so people can feel pain. So there's a lot of tightness and a lot of pressure. And when this is relieved, people may feel like they're looser, or they feel that the tightness is diminishing, it's going away, and their pain may start to go away. So again, there are two aspects for the craniosacral fascial system. There's the craniosacral aspect, where the brain is breathing and the sacrum is moving with it to allow the brain and the spinal cord to breathe. And there's also this fascial web that's throughout the body that is creating tightness during trauma, and that starts to loosen up, and this whole system starts to work to bring people better health. Dental procedures can have a profound effect on this craniosacral fascial system. The first aspect is that the dentist can possibly restrict this expansion and contraction of the brain in a number of ways. And just some things that could be done: any type of maxillary or upper jaw appliance that snaps into the upper teeth can restrict the normal expansion and contraction of the maxillary bones in the face. And like a domino effect, once this becomes tight and restricted, it can possibly restrict the actual expansion and contraction of the brain motion. So, to give you a few examples, you could have a maxillary appliance like a TMJ appliance that snaps up into the upper jaw. If you grind your teeth or clench your teeth, if you have this appliance up there and it snaps on, it can restrict the motion of the face, and then it can restrict the motion of the brain, and it can take your brain cycle down to zero. It's something we don't want. We want a lot of freedom around the brain, where the brain can fully expand and fully contract. You might see this in a full denture if somebody has all their teeth out and the denture is placed up on the upper jaw and has to be glued in and has to be very, very tight. Well, this tightness can restrict the motion of the brain. And if you have a partial denture and that denture plate snaps up onto your roof of your mouth and it snaps up there, that can restrict your brain motion. So there are many appliances that can be used that can restrict brain motion. The second factor would be extractions. If you're having a tooth extracted, say you're having an upper molar extracted and there's a lot of pressure on the maxillary bones, and you're in a position like this and there's a lot of strain caused, or saying you're having your wisdom teeth out and you were and the dentist is extracting digging around into the jawbone of the lower jaw, and there's a lot of trauma in there, there's a lot of strain. It can create a lot of craniosacral fascial strain, not only around the tooth, but also in the TMJ, where you may, after the procedure, you may have a headache or a neck ache. So tooth extraction would be our second avenue. Our third avenue would be a positional situation where, say you're having a root canal, say you have a long procedure, and you're having a root canal, and you hold your mouth open for and your mouth is open. And at the end of the procedure, at the end of the hour, you leave there and say, gee, I got a headache, or my neck is tight, or I don't feel right. It's because possibly you had craniosacral fascial strain introduced into your system. And it's very, very common after you have a cleaning, where you're lying back and your neck may be twisted and the hygienist is working on your teeth, and you're in a bad position for 10 or 15 or 20 minutes. And after the visit, you say, oh, gee, my neck is a little stiff and I'm starting to get this low-grade headache. Well, that procedure may have created craniosacral fascial strain. So in dentistry, we want to be cognizant of the fact that during procedures, strain can be created. Orthodontics may have some restrictive factors also. The orthodontist is trying to move teeth around, and our goal is to use very, very minimal forces to allow the brain to fully expand and fully contract. There are certain appliances that I like to use that are possible situations for your child. I like the Bionator appliance, the Crozat, the Herbst, and the Frankel appliance. I also like alternative light wire function. These usually apply very minimal forces to the head to allow the teeth and the bite to shift in correct position. Some orthodontists like to use heavy metal, they like to use headgears, they like to use maxillary appliances. Sometimes these can be restrictive and they can take the brain cycle down, or possibly down to zero. The ultimate goal in orthodontics is, when you're having whatever orthodontic procedure you're having, is that the brain is fully expanding and fully contracting, that your child has a really nice brain cycle that we created in therapy. What we don't want to see is your child has a really nice brain cycle, and then we go for orthodontics and all of a sudden everything gets very, very tight, and your child may have a low brain cycle or the brain cycle goes to zero. So when you're interested in orthodontics, You want to ask the orthodontist about craniosacral motion, about brain motion, and get in sync, get the therapies in sync to have your child get the best result. I think dental prevention at birth is going to be a huge thing in this century. We did our research study with 800 babies over 6 years, and what we found was in about half of those babies, about 400 of those babies, they had TMJ. And what it showed up was, it showed up as nursing issues. The baby had difficulty latching on, the baby had difficulty swallowing, the baby couldn't suck well, the baby had oral pharyngeal problems where their jaws were tight, their jaws were in pain, they couldn't nurse that well. And we were amazed that this number was so high. So I believe that TMJ and dental issues, oral issues, can start at birth. One interesting side effect that we noted, that a lot of the babies had narrow palates. And if you're a newborn, you want your upper jaw, your palate to be something like this, where you can put a finger in there and wiggle it back and forth and you'll have a nice wide face. A lot of the babies didn't have that. Instead of having these type of palates, they had the V-shaped palate, where you tried to put your finger up there and you just got stuck in the V, and the face was narrow, there was a V-shaped. And what was really cool in our therapy with the newborns was we found if we did maybe 10 minutes of therapy, that child's palate could go from a V-shaped down to a normal shape. So I was thinking to myself, wow, this is a great thing for orthodontics, that it would avoid a lot of crowding in the future, a lot of palatal expansion, a lot of orthodontics could be prevented at birth. So, and what we found was in the TMJ, there was a lot of craniosacral fascial strain, which created a lot of misalignment down the road, we anticipate. So we feel that by relieving the strain in the oral pharyngeal areas at birth, everything, the TMJ is loose, the palate's loose, the tongue is loose, the floor of the mouth is loose, the throat area is loose. Everything is working well, the child can breathe, suck, and swallow. Everything is loose, everything's functioning well. We believe that will hold true for less dental problems down the road. Thank you.